Thank you so much, Annika, and for really delivering on that message about the strength in vulnerability and the importance of openness. I want to build on a comment that you made about the gender element when we think about perinatal mental health. And I think generally we focused on women. And we've come to recognize that fathers play an incredibly important role, not only in the experience of their partners who may be going through depression or anxiety in the perinatal period, but also in and of themselves. It's a developmental step. It's a developmental hurdle for many young fathers. Our next speaker is going to teach us a fair bit about this. Dr. Andrew Howlett is a member of the Department of Psychiatry at Mount Sinai Hospital, the University of Toronto, also works at St. Joseph's Hospital, and is a collaborator also at Women's College. He is studied medicine at Dalhousie University and did his psychiatry training at the University of Toronto. And along with Ben Rosen, he co-founded the Fathers Mental Health Network, first in Canada, which focuses on improving the health of fathers as a way of improving the health of fathers and their families. He's a child psychiatrist and an adult psychiatrist, and has worked extensively in engaging and treating fathers and their families. He is also a proud father of 2 young children, and is deeply committed to helping families during the early years of parenting.
Good evening. Thank you, Moen, for the introduction and the invitation to participate in this important community event. It is a pleasure to be able to join this wonderful group of panelists and to have the opportunity to share with you why it is important to also engage and support men throughout pregnancy and especially during the transition to parenting a new child. The motto of our Fathers Mental Health Network is that healthy fathers leads to healthy families. Today, more than ever before, men are embracing their role as fathers, and with that, experiencing greater excitement, joy, as well as stress and even fear. Dads are defining themselves not just by their ability to provide for their family, although that remains very important to them, but also in their efforts to nurture their child, to be present in the moment with their child, and to assist in planning for their child's tomorrow. We know that a child's first 2,000 days are extremely important in establishing the foundation and trajectory of their health, including their physical, mental, and social well-being. And of course, each and every one of us shares the common goal of wanting only the best for our children. In order to support the development of beautiful and resilient kids, it is important that all parents, both mothers and fathers, be curious about parenting, and that we reflect often on our level of stress and anxiety, and pay attention to our feelings, especially when we feel sad, frustrated, and angry. Ultimately, it is important that both mothers and fathers seek support early when it is needed. That being said, it is not always easy to find the right support, and men often have a much more difficult time establishing that supportive network during the perinatal period, as well as accessing helpful resources. In fact, for dads, the frequency of contact with friends and supportive individuals typically decreases during this time. Men in general are less likely to see a physician on an annual basis, have regular checkups, and focus on disease prevention. However, becoming a father has also been a great motivator for men to improve their health in general. And it has been our passion to capitalize on this motivation as a pivotal moment in men's health and men's mental health. When I speak with fathers, I consistently encourage them to reach out to one another. And at the same time, I know it can feel rather awkward speaking honestly to a friend or another dad about parenting and related matters. I can distinctly recall the limits of my own social comfort this past summer when I was at the park with my son and wondering whether or not I should start up a conversation with the other dad in the sandbox. And yet, one of our greatest gifts that dads can give their child is to model how we can positively embrace our social opportunities and engage with others in the world, starting from that simple gesture of a handshake. But let's face it, parenting is stressful. The stress of becoming parents can be good. It can force us to reevaluate our priorities, our interests, sometimes our values, and even ourselves. But the stress can also be negative. And there's a long list of distressing things that could include just finding time to look after the everyday things that were happening before we had a child, looking after the puppy we got just before we realized we were pregnant, not being late for work, finishing work on time, getting home on time, soothing a crying baby, sleep training or not sleep training, pleasing our boss, our partner, our mother, and of course our mother-in-law, completing the extra work we agreed to because we were used to having so much extra time, paying bills, did I mention paying bills, dealing with the disappointment of our boss, our partner, our mother, and of course our mother-in-law, wanting to be there for our friends and extended family, and at the same time needing to be home, feeling overworked and underappreciated, having to call the landlord because what didn't seem like a big problem is now a big problem because we have a baby in the house. Or having to talk to our partner about all those things we can no longer avoid talking about because we now have a baby to look after. Dads quickly see the pattern. Stressors rising, and the number of ways of managing that stress decreasing. It is obvious we need to work towards finding a greater balance so that we can manage these overwhelming times and prevent ourselves from experiencing something more serious. In my experience working with couples, especially in a group format, you can appreciate the relief that comes over them when parents realize that some of their stressors and challenges are actually quite universal. It's good to know we're not alone. But whether your couple's group is a formal one or an informal one, it can be deeply enriched by hearing about the dad's experience. You've heard a little bit about depression in mothers, and yet rates as low as 1 in 5 mothers seek treatment. Unbelievable and unacceptable. To make matters worse, depression in mothers has been strongly associated with the development of depression in dads. Believe it or not, this time in our lives when things are happening as we were told they were supposed to, creating a home, having children, perhaps also taking on a new initiative at work, it's also one of the most vulnerable periods for men to experience depression. Up to 1 in 10 men suffer from depression during this period. Studies also show that when dads are depressed, mom's depression can be more severe and of longer duration. Depression can also make it difficult to feel connected to your partner, to get along with each other, and to feel like a real team when it comes to parenting. Imagine 2 parents excited and anxiously awaiting the arrival of their first child, only to find themselves holding that child with tears coming down their face and anger across their brow. Unfortunately, this happens. I've seen it. And maybe some of you, unfortunately, have had to experience it. But I'm grateful that in these situations, parents can overcome possible feelings of guilt and shame and ask for help. It has been a real privilege to support parents during these difficult times and to witness parents and families become well again. As a child psychiatrist working with children who may have had mental health issues, we take advantage of knowing that the child's brain is changing and developing, and that some of the difficulties of today will naturally become easier over time. This theory also applies to parents. Both their infant and their relationship are changing, in many ways beyond their control. But I'm sure our elders and our families and our faith have reminded us of this, and it is comforting to know that there are services out there when the process seems unmanageable. The dads I've met, whether or not they suffer from depression, often struggle with supporting their partner who may be dealing with anxiety or a mood disorder. It can be difficult for them to convey their love and support, especially when their wish is to fix the problem and end their partner's suffering immediately. If only depression were as easy as fixing a meal or changing a light bulb. And even those simple tasks can be difficult when you're feeling miserable. Supporting a loved one who is suffering from a mental health condition can be challenging as we try to find the right words and the right action to support them at any given moment. In Dad's best effort to make his partner feel less depressed, we often attempt to change mom's feelings and perspective, and consequently this is sometimes experienced as dismissive and invalidating, to which dads then feel frustrated and depleted. Listening and accepting your partner's feelings, as painful as it might be in the moment, does not mean that these negative feelings will persist. A Swedish proverb reminds me that shared joy is double joy, and shared sorrow is half the sorrow. Knowing this, it can still be difficult for us dads to support our partners when we are also suffering from an overwhelming level of stress, anxiety, or depression, and in need of similar compassion and support. In our attempt to look after the mother and child, dads tend to neglect their own needs. This neglect can lead to withdrawing from the family, isolating ourselves, having difficulties at work, perhaps having fantasies of wanting to escape or rely on unhealthy ways of coping. In my experience, dads who can find a way to also prioritize their own emotional well-being, and by that I mean talking to someone about their distress, engage in a healthy coping activity, explore and accept treatments when needed, become even more effective at supporting their family. If you've been suffering with sleep deprivation, headaches, forgetfulness, thinning of your hair, slight weight gain, significant debt, and loss of self-identity, then you may be suffering from parenting. Perhaps you heard I was going to say depression. And while dad jokes may be funny, being a dad and of course being depressed is no joke. Depression is of course more than those things, and if you or your partner have been concerned with how you're feeling, coping, or functioning, then I would encourage you to reach out to someone, perhaps your doctor, and ask for help. Perinatal programs, such as the one here at Mount Sinai, where my colleague, Dr. Ben Rose, and I recently joined Dr. Delphin and her team, work together to look after the whole family. To learn more information about father's mental health in our service, please take with you one of our pamphlets that are available in the foyer. Again, our goal is to help our community raise beautiful and resilient kids. This requires healthy parents, effective co-parenting, and in some cases, specialized help, including perinatal mental health for both mothers and fathers. Helping dads doesn't take away their ability to manage things on their own, rather it makes it more likely for fathers to feel confident, comfortable, and successful in supporting their partner and raising their children.